very complicated at the beginning because hospitals and community services really grew out of a very old system before 1948. And so there was the need for some definition about what each trust or each organisation did. So in the 90s, when there was an almost big political change with the NHS, it was decided that trusts had to encompass certain services to make sure that there was a comprehensive set of services available to patients. And it was decided to do that, they would need to attain a certain quality to become deregulated and more autonomous. So the concept of foundation trusts was developed. And this proved very popular at the beginning, and a lot of trusts, a lot of hospitals and community-based services applied to become foundation trusts. This allowed the government at the time, the Department of Health, to not only define the services that went on in there, but also to improve the quality of those services. Now, you may have heard that there's a quiet revolution going on in the UK about provision at the moment, and that again will bring into question what a trust is if you're going to have amalgamations of trusts, coordinated trusts throughout the country. So these are called vanguards at the moment, where we're trying to bring like-minded people together to run acute trusts and others to coordinate services across community, mental health and primary care. Firstly, mental health was often a forgotten part of the system, and mental health trusts were often funded very poorly. Mental health provision, was often funded very poorly. It didn't really get a place at the table to discuss health strategy. And by enabling them to become a voice as a trust, and mental health trusts have patient representatives on their board as part of their governance, there was an awareness suddenly of the importance of mental health. So I think it's been a major advantage to mental health services. And I think it's led to improved quality of mental health. And we can define that in whatever way you like, but the experience of the patient is the one I would use. And good trusts report very good patient feedback and very responsive care. And I would say that that's one of the successes of the trust system. It's very interesting because if you're a patient, all you're really interested in is the care you're going to get. Whether you're a trust or not a trust probably doesn't enter into it. However, trusts have memberships. So patients can opt to become members of the trusts so that they can influence the way services have been delivered. And mental health trusts in particular have noticed that has been a very successful thing. So a lot of what you heard this morning about patients who are receiving care from trusts, actually sometimes it's not more care they want, it's different and in a different setting. And they've tended to influence that debate. So you've seen movements away from centralised systems into community-based services. And I think that's a strong element of that change. I think you would have to say that the major strengths of it now are that people think about the quality of that care, they think about the cost of the care to make sure you're getting value for money. Even if we're not always good at doing that, we're thinking about it so that we understand it. The third thing I think that's developed very strongly is a much more patient and citizen focus. Things are no longer about the system around you, it's about you and how the system responds. Helping that organisation be more accountable, not just for the outcomes in terms of the success rates in operating or the success regime of treating somebody with an affective disorder, but actually the outcomes that matter to patients, which is the timeliness of their treatment as well as the quality of it. What you see there is the interaction between people. And that's what you mainly get from these meetings. It's meeting networks of people who are doing different things to you. So I'm going to go home today with a better understanding of what integration means to somebody with mental health problems, because that's actually quite new to me. Because most of the time we talk about diabetes or asthma or COPD and not about schizophrenia.